Hi guys, you are welcome to our channel. My name is Mariah Alnaya. As you know, today we're going to be talking about how to avoid or to prevent tearing under there during delivery. There are two basic ways. The first method, you have to preserve that place and do some things to prevent the tearing. And the second way is on the day of the delivery, there are some things you also have to do to prevent the tearing. If you are wondering what are these things, then sit back, relax, and I will see you shortly. Yay! You're welcome back to our channel. My name is Maria, as I told you, and together with you, we journey together on this birthing thing and how it works in Nigeria. So if you're a first-time mom or dad, or if you're interested in that kind of thing, then you're welcome to our channel. Today we're going to talk about tearing. Tearing is an occurrence whereby the vaginal area, up to the anus, may experience some damage, or as the name implies, tear. And there are different degrees of tear. There's the first degree, which is really like a scratch or a bruise, and you don't need suturing or sewing for that one. There's the second degree tear, which involves some damage to the tissue around the vaginal area, and it may involve, it may or may not involve some suturing to it. I had a second degree tear because I had a cut, which is the technical term for that is an episiotomy. And there's a third and fourth degree tear. Those ones are severe tears, and they are damages that are done to both the tissues and the muscles of both the vaginal and anus areas. Okay, now that we have understood what a tear is, don't be afraid. Okay, a lot of women are afraid of tears. Of course, anything cutting, damaging, tearing, it's a painful thing, right? So it's best to avoid them, right? Yes, it is. If you envisage that you're going to have a vaginal delivery, there's some things that you can do pre or before the day that can help you, and I mentioned it before. You can get oils to have a perineal massage. You massage the area, your vaginal hole, and all the areas around it from time to time, just to make it a bit more elastic for delivery. You can use your hand, you can ask your spouse to use his hand to just stretch in a circular motion daily. Okay, that's one of the things that you can do. The first thing that you can do. The remaining things that you can do are all dependent on the day of your delivery. And the first one is on the day of delivery or the day before delivery. It would be nice if you have a birthing ball, right, that you can roll on back and forth to open not just your cervix but the cervical area, to expand it, to work on those muscles to help you pull it. So yes, even before as you're doing the perineal, you can also be sitting on the birthing ball. Actually, those are two things you can do before. But if on the day of delivery itself, you can engage in that exercise as well, and it will help to loosen those places. The second thing is the position of delivery is very important. It is said that any position that works with gravity helps to aid an easier descent of your child. So maybe you are bending, or you're squatting on all fours, or you are crouching or sitting. And even if you want to lie, do not lie totally horizontally on your back, like plain like that. Lie at an angle. It will help the descent of that child. I was lucky enough that the hospital that I went to had an adjustable bed, so that my bed was tilted at an angle. But most women may not be lucky enough to have that in Nigeria. But if you can, if they have, speak with your doctor that you want a position prior to birth, a position that gravity aids the flow and descent of baby in. Okay, that is the third thing. The fourth thing that you can do is when you are pushing out your baby, and this is one of the most important things you can do. We're talking about 5 things, right? This is one of the most important things that you can do when you're pushing out your baby. Do not push out your baby in one go. At a point, you may have that burning urge to push out your baby like that, especially when your baby is crowning, when your baby is, they call it the ring of fire, your baby's head is already dead. Please don't just push out with force as if you want to get this thing out of you. Please don't do that. Just push out slowly. Do not push your baby out in one go. Try. It's not easy. It's not easy. You can hold your breath like that. Breathing techniques, they help you to push out your baby gradually. If you can push out your baby in 3 goes, then it will, not just it may, reduce the tear, because the force, the pressure can break the skin. Okay? And the final thing, which is the 5th thing, please discuss with your medical personnel or the person that is helping you to deliver, maybe a midwife, by the way, that except absolutely necessary, you do not want an episiotomy. It has been proven that episiotomies actually help to increase cuts, increase the tear. Okay, except absolutely necessary. My case was absolutely necessary, and that was when she did it, because she wanted to put a suction, something to pull out the baby. She wanted to put it in. So if you're not having that kind of delivery, you can go and watch my birth story to understand. If you're not having an interesting delivery, then you have well, your doctor would know. Actually, let me not say that. Your doctor would know what you need. I needed to have that, and my doctor provided that for me. So your doctor would know what you need. Just make sure you hammer it into the person's ears, or the person that is delivering you. It could be your doctor, it could be your midwife, and except absolutely necessary, you do not want an episiotomy. Okay? And those are the ways. Okay, so why, before I close, why is it that an episiotomy? Imagine a paper. When you cut a paper, right, if you pull it apart, it's not easier for it to pull apart. But if you not cut a paper and you're pulling it, it's not easy for that paper to tear. The same thing with the clothes, the same thing with anything. That's the same mentality. If you cut something, it's easier for that thing to fall apart. But if you've not cut it, that thing can still withstand the pressure. So here are the 5 points I've mentioned: perineal massage, rubbing against, as in some exercises that help, to expand and loosen that area, your birthing positions, your pushing, don't just push all at once, and finally, do not just have an episiotomy just like that if you can avoid it. These are the 5 tips that I know and I can remember, and I hope that this has helped you in some way. Wishing you a wonderful birth and delivery. Take care of yourself. Much love.